So we are on chapter 5, which covers anxiety, OCD, and related disorder. This is module 2. I want to just mention a few things about the different types and diagnoses under this category. So it's a broad category with a number of diagnoses of psychiatric illnesses. It includes generalized anxiety disorder, phobias, panic disorder, social anxiety, obsessive compulsive disorder, although in the DSM-5, OCD technically falls into a different category, but there is a strong component of anxiety, so it's covered under the same topic in the textbook. So I just want to say a few things. Generalized anxiety disorder is a disorder in which people tend to have a lot of worry thoughts, and it's sort of like a long haul set of symptoms. So you see people worrying, having some sympathetic nervous system arousal, which would be increased heart rate, sweating, clammy hands. That's not uncommon. People typically get fatigued, and the reason is because when we are in a heightened state of sympathetic nervous system arousal or fight or flight, that is energy consuming, and we get tired. People with GAD typically have irritability as well. You can think of it as sort of a moderate level of anxiety that just keeps going, okay? That would be a contrast to, let's say, panic attacks or panic disorder, in which people have recurrent panic attacks. And on a scale 0 to 100, if you're thinking 0 would be someone who is calm and relaxed and just in a state of perfect tranquility, and 100 being as anxiety laden as you can be, panic attack is up there. We're talking, 80, 90, even 100, okay? So it's a sudden onset of intense anxiety that is overwhelming. People typically have a lot of physiological discomfort, such as heart rate goes up, sense of chest tightening, sense of sort of panic of losing control, being overwhelmed, fear of dying. Panic attacks are not very long lasting because we can sustain such a high level of sympathetic nervous system arousal for an extended period of time, but it can be very overwhelming, okay? Phobias are the type of disorder in which people are afraid very intensely of a specific object or situation. Okay, that could be spiders, heights, water, etc. What's important here is that the fear is irrational and people have a strong need to avoid, or they avoid that which they are afraid of. Okay, one of the most effective treatments for anxiety disorders would be cognitive behavioral therapy. One very important type of behavioral therapy is exposure, where people do the very thing they're afraid of. So with a phobia, a person, let's say, who has height phobia would have a treatment protocol that involves climbing on ladders, exposure to heights, and learning how to tolerate that, and waiting for the fear to subside. I want to mention a few things about OCD, or obsessive compulsive disorder, which is a disorder that has two components, obsessions and compulsions. Obsessions are thoughts, and they're thoughts that are anxiety provoking, such as fears. Could be a fear of germs and getting sick. Okay, and they tend to be excessive, and the person tends to be preoccupied. Okay, and then there are obsessions, and obsessions are behaviors that people typically engage in order to reduce the anxiety that comes with the obsessions. So for someone who has obsessive compulsive disorder that involves fear of germs and getting sick, that person may have compulsions that would include excessive hand washing, right? If the person is concerned that they touched a doorknob and they could catch a disease, and they go and they wash their hands once or twice or 3 times, that's not OCD, right? It might be obsessive compulsive tendencies, but OCD really means that this is excessive and time consuming. So with the example of excessive hand washing, sometimes people can engage in washing their hands for 10 or 15 minutes until the skin on their hands is raw. That would be considered above and beyond of what's typical, and that could fall under the category of OCD. The most common treatment for obsessive compulsive disorder is exposure therapy with response prevention. So exposure would be exposing the person to that which they fear. So in the case of excessive hand washing and fear of germs and getting sick, the person, let's say, would be asked to go to the bathroom, touch the outside of the sink and the faucet and not wash their hands. The not washing their hands is the response prevention, right? The person has a natural increase in their anxiety. They want to alleviate their anxiety by washing their hands, but the therapist helps them not wash their hands. That's the response prevention part. So they can see how their anxiety gradually goes down and they can be fine. Okay? So it's exposure with response prevention as a highly effective and very commonly used treatment for OCD. I'm going to pause here and I will see you next time. Thank you for your attention. Bye.